This is a proctor sheet. Alright.
Okay, so 25-year-old female on the floor, awake but disoriented.
Okay. I've got my PPE. Is the scene safe?
Yes.
NOI is seizures and chest pain, correct?
Yes.
Number of patients is 1. I will go ahead and call for EMS assistance, and I will not administer C-spine. Okay. Let's do. My general impression is 25-year-old female, lying on the floor. She is awake, but she's a little disoriented. I'm gonna check her awareness. Hey ma'am, do you know where you're at? You know what's going on a little bit?
A little bit, not much.
A little bit. Okay. You know how many fingers I'm holding up?
3.
What about now?
1.
What about now?
6.
Okay. Your awareness and level of consciousness doesn't look too bad. The chief complaint will be seizures and chest pain. I will go to assessing the airway. I'm gonna assess the airway. Can you open your mouth for me? Airway is clear. I'm going to check breathing. Listen for lung sounds. How's the breathing?
Adequate.
Okay. What about my respirations? Vitals.
22.
Okay, I'll go on to checking your circulation. I will go ahead and check your pulse right here. And while I'm checking this, I will check for equal chest rise and fall on your chest while you're breathing. Okay. I actually got 72.
Okay.
But what does the paper say on vitals?
Pulse is 132.
Okay. I will go ahead and put you on a nasal cannula at 6 liters per minute for oxygen.
Okay.
Then after that, you're a priority patient, but we won't do lights and sirens. We'll just head to the closest hospital and try and get you taken care of. But as far as that chest pain, do you know what kind of started that at all?
No.
Does anything help? Like, anything help? Anything make it worse?
No.
Like sitting in a certain way or anything? What about the quality? What kind of pain is it? You say it's sharp,
yeah,
dull,
sharp.
sharp.
Just want to take a deep breath.
Just when you take a deep breath. What about, does it radiate anywhere? Do you feel it whenever you take that deep breath? Does it do you feel the pain anywhere else in your body?
Yes, down my left side.
Okay. What about the severity? On a scale of 1 to 10, 1 being hardly
6.
anything, 6? How long has your chest been hurting like that?
2 days.
2 days? Okay. Do you have any allergies? Are you allergic to anything?
No.
What about medications? What medications do you take?
Tegretol.
Okay.
Tegretol.
Do you have a history of seizures?
I
I'm
do.
assuming if you take that.
I do have a history of seizures, yes.
Okay. What was your last oil intake?
Breakfast.
Breakfast?
I didn't have any lunch.
Okay. What about, do you remember what you were doing leading up to your seizure?
No, I don't.
You don't? Okay.
The last thing I remember is having breakfast.
Okay. That being said, I'm going to check your cardiovascular system. Just say no every time I check it. Okay. I'll check cardiovascular system. How does that look?
Okay.
How does cardiovascular system look?
No. Oh,
Or good?
good.
Yeah, perfect. Pulmonary system,
Good.
neurological system,
Good.
musculoskeletal,
Good.
gastrointestinal, and
Good.
urinary.
Good.
What about reproductive?
Good.
Psychological and social,
Good.
and gumetary, your skin, basically.
Good.
Good. Okay. Well, with that being said, on our way to the hospital, we'll keep you on oxygen, and the paramedic will put in an IV and keep you on, administer IV fluids on you, and we'll reassess you every 5 minutes until we get to the hospital.
Sounds good.
Boom.
Boom.